PDT, or photodynamic therapy, is a really interesting treatment that seems to work in some people really extraordinarily well. So what we're interested in doing is looking at this PDT and seeing if it can be used for lung cancer patients, and in particular for people with very early lung cancer lesions. So these lesions aren't even actually cancers. They're what we call precancerous lesions, and we know that they can turn into cancers. So we're interested in looking at PDT as treatment for these lesions because currently there's no known treatment. Lung cancer is an enormous problem, both in the UK and actually all around the world. Lung cancer kills more men and more women than any other cancer. In the UK alone, there's 34,000 deaths a year from lung cancer. So we're interested in trying to capture lung cancer early. When you capture lung cancer late, it's often too late to give a curative treatment. So how are we going to catch these cancers early? Well, currently we know that these pre-invasive or precancerous lesions can go on to form cancer. So what we want to do is capture people with these lesions and treat these lesions and use a treatment and actually examine whether the treatment works or not within a clinical trial. So how many people is this out in the UK with these precancerous lesions? Well, we don't exactly know, but we're suspicious that there could be, maybe 500,000 people walking around with these precancerous lesions that we think that should be offered some sort of treatment if we knew that treatment worked.
What might cause these lesions, and how would you know if people had them? Do I have them, for example?
Well, smoking will be a cause of these lesions, as it is of lung cancer itself, of course, but then there can be other causes for lung cancer formation and the formation of these early lesions. And that might include asbestos exposure to radon, the radiation that comes out of granite,
yes.
And indeed diesel fumes are thought to cause lung cancer.
Right. So what is your idea, once you've identified these patients, what would the treatment actually involve?
So photodynamic therapy, PDT, how we give it is the patient would come up to a hospital. They would be given the photosensitizing agent, so the drug, into the vein. And then with a new drug now, we only have to wait a couple of hours, and then the patient would come down to the bronchoscopy suite, which is where we do these telescope tests. And they would simply have a little bit of sedation to make them sleepy. The telescope would just go down into their lungs, and then a laser would switch on the light, which then targets the cells carrying the drug.
How long might it take before you knew it had such a great effect? Yeah,
so not long. So what we would tend to do is have a look the next day just to make sure everything looks fine. And then we would look again in 6 weeks' time. So we would look both to see if we could see the precancerous lesion, and then we may even do a little biopsy just to completely prove, or not, that this precancerous lesion has gone.
So what happens to these people, these patients now? I mean, are they left just to get on with it, or is there some treatment that conventional medicine at this point uses? That's
right. Well, it's a very difficult area, actually. So what tends to happen, there are a few very specialised hospitals that are interested in these precancerous lesions. These hospitals may just follow these lesions to see if they can catch a cancer really early if it develops. And actually in other parts of the world, they tend to treat these lesions. And this may involve surgery, for example, where they actually cut out that part of the lung. We don't think that's the right thing to do because we're not exactly sure what's going to happen with these precancerous lesions. We know that some of them can actually get better by themselves, a few of them. And the other big problem is that you may well develop a cancer elsewhere in the lung. And if you've already chopped out part of the lung, then that cancer might be difficult to treat, which is why we think PDT could be a very good option for these lesions, where we just simply shine a light, kill off the pre-invasive cancer, and then again we can just follow up the patient afterwards.
So I understand that you at UCL in London, University College London, and in the clinical units there, want to try out some clinical trialling to see if this treatment would be effective and perhaps save lives where the lives wouldn't be there.
Yeah, that's exactly right. So what we'd like to do is actually show whether PDT works or not in a clinical trial. So what we would do is we would aim to take 100 patients and basically divide them into half and show over time whether PDT actually works or not.
Why hasn't this happened before then?
I think the thing with PDT, photodynamic therapy, has many users around the world that are really keen on the idea and really believe in it. But I think one of the problems with any medicine is actually, to show the whole world that photodynamic therapy works, you need to have a really well-run, careful clinical trial. And at UCL, we do have the resources to do that. So we have a really good clinical trials unit run by Cancer Research UK, and we have clinicians that are interested and technically able to deliver this therapy as well. So we're actually in a fairly unique position to be able to deliver the trial that we need.
Right, so you have the patients lined up to try these trials out on?
So what we want to do is we're going to marry up with Manchester and Cambridge, and we're going to basically run it as a multi-centre trial. We believe that we've got over half the patients already actually to run this trial, and then we would collect the extra patients we need over the first 2 years of the trial.
So when would you start to know or feel that it was successful or not?
Well, this will be slightly different to a normal cancer trial. So a normal cancer trial, you can see your cancer, you give your treatment, and then you measure it, within a few months to see whether the cancer has shrunk or grown. What we're treating is pre-invasive or these pre-cancerous lesions. So we need to wait to see whether these lesions go on to develop a cancer or not. So what our trial is going to do is to follow these patients over 3 years to see if they develop a cancer.
Now, most people who watch this will be thinking, but it's pharmaceutical companies that do all the trials because you need millions of pounds to do it. And maybe it's best done in Europe or it's best done in the States. What do you say to that?
Well, I think there's two questions there. One is funding, and the second is whether the UK is the right place to do these trials. Well, the UK is the right place to do these trials. We have very, very good setup for clinical trials now, and the clinical trials that are done in the UK are believed throughout the world. So they're done in a very stringent way. The second thing is the funding. So funding of clinical trials, often for cancer in particular, does come from drugs companies. What we're proposing is an academically led trial, so we as respiratory physicians will run the trial. The company will supply the drug free, but we are applying to national bodies to fund the trial so that we are completely in charge of it, completely in charge of all the results. And all the results will go through the clinical trial centre and be published. So whether whether it works or not, there will be a publication and we will know.
So what's the point in talking to the PDT group in Norfolk? What do you hope that they might be able to do to help?
We are interested at UCL in it. Lots of people knowing about our work and supporting our work. We're also interested in gaining support financially. So the trial is going to be expensive. We estimate that it will probably be over £1 million to run the trial. So, but that will include many things. Some of those things will be the costs of the actual procedures, and we'll be applying for money from the National Institute or CRUK to run that. And other things is actually staffing costs for trials. So we'll need, for example, a clinical fellow to follow the patients really carefully, see what happens. We're also interested in actually taking samples from the patient's lesions to see the effect of the photodynamic therapy. So this could all be research for the future as well. Because it will be a randomized controlled trial that we're doing, so the evidence will be strong enough to take to NICE. So then the government body, NICE, would have a look at it and they would have to work out, okay, what's the effect and how much does it cost? The whole idea of our trial is that we can finally supply the evidence or not that this treatment works, and from that we will be able to work out whether it's cost effective, and if it is, then NICE will approve it and it will be rolled out across the country.
Thank you very, very much, and good luck with your funding. I'm sure that Norfolk PDT will be there with you. Thank you, Sam, for coming.